So you're going to go over the case study slide, and then bam. Here at Buckeye Anti-Aging and Aesthetics, you're here at ARM Miami, or here at Buckeye Physical Medicine and Rehab, because we specialize and we're a complete hormone replacement therapy center, we know that it's vital to cover all 4 pillars of your hormonal health. All right, we're going to go through these, and we look at it as a good, better, and best scenario. So understand that when we're treating these, we run off blood work. All right, we're not taking shots in the dark. People lie, but blood work doesn't. So we're going to give you a sufficient amount of what you are factually deficient in. So first thing, we're going to check your vitamin D. Vitamin D is amazing. It's a heavy precursor to your hormonal system, so it feeds into all of them. The problem is the best source of vitamin D is from the sun, and we have a problem with sunlight deprivation, and none of us get out enough. So we're going to test your vitamin D and get that where it needs to be. Good. Even better, your sex hormones, testosterone and estrogen. Of course, you heard Dr. Korth on the radio, and he went into a lot of the benefits. We're going to address your estrogen. For women, if you're deficient in estrogen, we're going to give you a sufficient amount, okay? For men, when we address your testosterone, we're going to manage your estrogen. So when we pull it to a healthier level, John, this estrogen starts to want to rise, so we're going to give you an estrogen blocker if that happens, to keep that where it needs to be. You do need a little bit, though, and we'll ensure that for you. And both men and women, it's going to have a heavy effect on your libido, bone and joint health, and cellular production, okay? The next two, testosterone and growth hormone. The testosterone in both men and women, it's one of our body's most elite anti-inflammatories. Inflammation causes aging. Inflammation causes pain. So decreasing that inflammation is huge for all of us, and we'll go into more benefits. And lastly, what we call the second half of our hormone replacement therapy, the growth hormone. It strengthens all of our connective tissue, so our blood vessels, joints, hair, skin, nails, and we'll get into that farther as well. Hitting more onto the testosterone, as I said, it's one of your body's most elite anti-inflammatories, so aches and pains go away. Degenerative joint and disc disease, cardiovascular disease, strokes, heart attacks, Parkinson's, Alzheimer's, all inflammatory processes. Now, the note I'm going to make on these two, insulin resistance and better sleep, hit them both because they get hit on the next side with growth hormone. So decrease insulin resistance, so it's going to be a lot easier to get the energy out of your foods rather than storing. So getting your metabolism where it needs to be or where it used to be, okay? Rather than eating, as I said, rather than eating a big meal, getting that crash, tired feeling, and storing all that energy onto our midsection. Better sleep, when we put your testosterone to a healthier level, it's going to help with the quantity of your sleep, so not losing sleep sporadically or halfway through the night, okay? Then you're just going to finish, increase sex drive and performance, increase mental focus and clarity, increased energy as well. So next is growth hormone, and we test this through your blood work as well, through your blood as well. As I said, it's going to strengthen your connective tissue, so blood vessels, joints, hair, skin, nails. Cater this to a crowd. If it's a woman, say, so, and use the word more for both men and women always. So if you're somebody that's going to need your hair to grow in more full than what it is, and your nails to be more thick than what they are rather than frail if you're having that issue. If you're starting to feel frail or weakened, this is definitely something for you. Or John, because you are a powerlifter and you have 3 kids, if you're somebody that needs more joint integrity and healing, better repair on your muscles for the next day, this is definitely something that you're going to want to look into. Drastically reduces our body fat, so where the testosterone helps get our metabolism where it needs to be and get the energy out of foods. This belly fat increase is an indicator of low growth hormone levels, so it actually helps attack those fat storages actively while you're also getting energy out of your foods rather than storing them. Strengthen immune system, deeper sleep, where testosterone is going to give you the quantity of sleep. If you're somebody that needs more rest and regeneration, growth hormone is going to give you that deep quality sleep so you can wake up actually feeling like you had rest. Increase muscle mass as well. For men, this is going to help you with recovery and build and help not lose that muscle as you are working out. For women, so as you're tightening up, or what this is going to do is preserve that muscle so we don't have a quote unquote skinny fat look that nobody wants, of course, or a weak gaunt look as you're losing weight. Alrighty. Then you're going to sell your HRT. Testosterone, estrogen, you have the treatment, sell it $200 a month. Now for the growth hormone, it is a separate investment. Now growth hormone's amazing. The problem is the only way that you used to be able to treat it was actual synthetic growth hormone, and that is $2,000 to $4,000 our cost. That's why only people in Hollywood could afford it. So you'd see them getting huge and jacked for a movie role, and then they'd get tight and shredded for a movie role. That's how they were able to do that. We want that imagery. Shouts out to Tyler Denver on that one. Good job, buddy. And it is effective. The other problem with fat is when you use synthetic growth hormone, it kills your natural production. We cannot have that. not producing growth hormone, huge problem. Your cells aren't going to regenerate. You're going to get weak, frail, several other issues. So with our elite level of growth hormone therapy that we do here, we use a growth hormone releasing hormone. So that secretes use the word maximum. That secretes the maximum amount of growth hormone that your body will secrete. Additionally, we match this with something called ipamorelin, which blocks somatostatin. Somatostatin blocks growth hormone and increases with age. So it gets tougher and tougher for our cells to regenerate because of somatostatin. So it's a two-part system. Our growth hormone releasing hormone increases the maximum amount of growth hormone. Our somatostatin blocker blocks the somatostatin so the growth hormone can be fully accepted by your body. This is an investment of $250, but we're not sure if you would even qualify for this treatment, okay? I qualify for it, and thankfully it's made a huge change on my life, and hopefully you'll be a candidate as well. So the fact is, we're gonna get your blood work back, we're gonna review it, and we'll get you started from there, whatever route we can.